Hello, viewers. Welcome to this episode of Healthy India. And today we're going to talk about oral cancer. We've discussed cancer several times in this series earlier. We spoke about prevention of cancer. We talked about the recent advances in managing cancer. We had a detailed discussion on breast cancer. All these episodes are available on the Sansad TV YouTube channel, and I encourage you to take out time to see them. Today, as I said, we are going to discuss oral cancer, and as usual, we have the best of the best for you. We have in the studio with me Dr. Alok Thakar, who is the head of Head and Neck Oncology at our very own All India Institute, New Delhi. And we have joining us on Zoom Dr. V. Lokesh, who is the head of the Department of Radiation Oncology at the Kidwai Memorial Institute of Oncology in Bangalore. So we have two very eminent people here to answer questions about oral cancer. Now we all know what is oral cancer. Oral cancer means cancer of the mouth in layman terms. It means cancer of the lip, cancer of the tongue, cancer of the soft palate around cheeks inside. All that is oral cancer, cancer of the mouth. Dr. Lokesh, I'll start with you first. Now, we do have some ideas seeing government campaigns and seeing around us that oral cancer is a common form of cancer. And it's apparently particularly common in India for reasons that some of us know. But I would like our viewers to understand a little bit more about how common is oral cancer and what is the Indian scene.
Thanks for the invitation, sir. When we look at oral cancer in our country, the oral cancer burden is huge in many of the cancer centers across the country. And when we look at oral cancers, it forms like the third or fourth in the rank list of the top cancers that occur every year. And when we look at the world scenario, the oral cancers are almost like 1/4 of the total burden across. And especially in our country, most of these oral cancers present in advanced stages, and they have a very strong causative factor, which is tobacco and chronic alcoholism and poor oral hygiene, which contributes to the increased cancer burden. And also what we occasionally also see is younger patients who have chronic habit of oral tobacco usage, non-smoking type, coming with cancers. So generally people have a perspective that cancer is of old age people related problem. But many youngsters succumb to this disease because of these kind of overusage of tobacco habits, and the burden of oral cancer is seen.
So I think you've set the stage very nicely, sir, by pointing out a few things. One of them is that oral cancer is particularly common in India. It is linked not just to smoking, but to smokeless tobacco. There is a huge relationship, and we'll go into depth discussing about that. You also said that many patients present in the younger age group, which is very scary, and also, unfortunately, many of our patients present in the later stage, which makes cure and much more difficult. So we'll come to you, Dr. Thakar, now, and we just heard, and Dr. Lokesh already outlined what are the main reasons why this is happening. So what actually are the risk factors for oral cancer? And especially, as I said, in the Indian context.
Yes. So, in India, oral cancer is the commonest cancer in males. It used to be lung cancer, but over time, oral cancer has just about overtaken lung cancer. And I think part of the reason is that our smoking demographics, our tobacco demographics have changed from being primarily a smoking issue where people used to take tobacco by smoking or by cigarettes or bidis into a smokeless tobacco situation. And when we say smokeless tobacco, we mean using pouch tobacco or zarda and that kind of thing. And because tobacco is now consumed more so by smokeless means, so naturally the impact of tobacco is also now more so in the mouth, where it is the prime carcinogen. I would say 90% of oral cancer is related to tobacco. That was our own figure published a year ago.
90%.
90%.
तो सोचिए आप कि मुंह के कैंसर में डॉक्टर साहब ये बता रहे हैं हमको कि 90%, 90% शायद सिर्फ टोबैको या तंबाकू से लिंक्ड हो. सो ये बहुत ही इंपॉर्टेंट चीज़ है. इसके माने बहुत सारा जो हम देखते हैं वो प्रिवेंटेबल है और उस पर हम आगे बात करेंगे. प्लीज़ करें.
बिल्कुल. सो प्रिवेंटेबल है. आप कह लीजिए कि हम लोग अपने आप पे इन्फ्लिक्ट कर रहे हैं, बिकॉज जो लोग टोबैको ले रहे हैं एट द स्टार्ट टोबैको कंजम्पशन, दे आर नॉट फुली अवेयर कि ये कितना एडिक्टिव है. एक बार जो है वो टोबैको कंजम्पशन की आदत पड़ जाती है तो इट्स इम्पॉसिबल टू लीव इट, एंड इट्स सो ईजिली अवेलेबल. पहले ऐसा नहीं था. पहले यू हैड टू गो डाउन टू अ पान वाला, गेट सम टोबैको, get a pan made. Now you carry it in your pocket and you can continue to use it as many times, so it's easily accessible, available. Tobacco consumption has increased. By that I mean oral tobacco consumption has increased, and because oral tobacco consumption has increased, oral cancer has exploded. So we really have a preventable cancer, or rather a cancer which we inflict on the population inflicts on itself, somewhat for lack of education and somewhat for societal trends, wherein this is a very acceptable way to take tobacco rather than to smoke, which is now becoming increasingly unacceptable in many situations. Yes.
So if we move beyond tobacco,
yes,
what are the other risk factors?
So we used to talk about the 5 S's or the 6 S's. So that's the easy way of knowing. So yes, tobacco itself, which was smoking, the S of smoking, tobacco, now is primarily smokeless tobacco. But beyond that, spirits or alcohol, sharp teeth, and that's a very important one. People who have sharp teeth, which tends to rub against the tongue regularly, can lead to this kind of problem. Spices really is not that every spice is so, but supari per se or areca nut is known to cause oral cancer, and there are societies such as Taiwan where it is totally driven by areca nut or supari, as whatever you may call it. So these are the other issues which can cause oral cancer, all of these. But as I said, primarily it's tobacco in our scenario, in the Indian scenario.
And in our society, do you think oral hygiene also plays a big role in increasing the risk?
So yes, you see, 50% or 48% of our adult population was noted as 48% of our adult males were noted to be using tobacco. So it's very prevalent in the rural areas, and that is itself associated with poor orodental hygiene. So they probably interlinked on each other. So yes, poor orodental hygiene, but poor orodental hygiene may primarily be linked to tobacco use rather than per se poor orodental hygiene. Yes.
Thank you. And of course, it's much more in men than in women.
Much more in men. In women, this is not the commonest cancer. In men, it is the commonest cancer. Women have a lower rate of tobacco usage compared to men.
So great. Thanks. And we go back to Dr. Lokesh, and we've discussed about the prevalence of cancer and why is it happening, especially in India. Dr. Lokesh, how should people suspect? How should one suspect that maybe I have something wrong in my mouth, maybe there is something that is growing, maybe I could be having a cancer? When should I see a doctor? Because, you know, we just talk of little ulcers. Everyone gets some little ulcers in the mouth on and off. There are very, very few people who have not experienced that. So what is really a symptom of malignancy there, and when should we see a doctor?
Yes, sir. Sir, just a second before I talk about this part, to the causes of cancer, one important thing that the public should know is many times what as doctors we have seen is the kind of non-smoking tobacco that people use, the quid or pan mixed with tobacco. Generally, people tend to keep it on one side and they keep it for very long hours and sometimes during their sleep also. We have seen people with quids being kept under the lip or under the tongue or on the right side or left side of the buccal cavity. And we were also, while we inquired with these patients, they informed that they used to keep it overnight also. So that was the actual site in which the cancer occurred. So there are very clear picture that the people should be aware that these cancers are definitely caused by these non-smoking type of tobacco also. And alcohol usage also contributes to deeper seepage of carcinogens to enter into the tissue. So that is the scenario. And now when we are looking at how one should look for the symptoms with which the people can present to their doctors with oral cancer, most of the time these patients would have ignored the burning pain when they take some spicy food or something, or they might have had chronic viral infection or some kind of irritable zones in the mouth, which they might have ignored, and they might have just continued without even looking at it. So most of these patients in our country, especially because more than 70% of them present with advanced cancers, they present with pain in the oral cavity, sometimes bleeding, or sometimes when they go to the dentist, they might have noticed some growth or an ulcer, which points to the oral cancer. And that's how these patients get evaluated further. But a person who doesn't have symptoms generally can just look at their mouth during brushing their teeth, and if there are incidences of bleeding when they're brushing their teeth, or pain, or some kind of a persistent sensation, chronic pain or burning sensation with aggravated by spice or some substance, they can one is examine themselves in the mirror, or and look for any surface which doesn't look healthy. And sometimes these patients can have some white plaques or some reddish zones. And some chronic users of tobacco we have seen, they come with very thick oral mucosa, some kind of a fibrotic strand, which over a period of many years of usage would have hardened, and sometimes there is so much difficulty in opening the mouth. So these are the kind of pictures with which people can present us.
We'll take a short break and be back with you soon with more information about oral cancer.
वाइब्रेंट भारत में इस बार देखेंगे तमिलनाडु का एक खास फेस्टिवल, दिल्ली से राजस्थान के रंग, हैदराबाद से मिनी इंडिया की झलक। रविवार रात 9:30 बजे सिर्फ संसद टीवी पर।
Welcome back after the break. I'll come to you, Dr. Thakar, and I want to ask you in detail about the surgery a little bit. But before that, very neatly pointed out by Dr. Lokesh about all the symptoms. Supposing I get an ulcer, when should I be worried about it? ये सब viewers पूछते हैं कि मुझे मुंह में छाला हो गया।
जी जी।
तो हर छाले के लिए तो मैं डॉक्टर के पास भागूं, क्या करूं?
नहीं, so of course you said it, and Dr. Lokesh said the same thing, that ulcers are frequent, and ulcers are especially frequent in people who are using tobacco. Some minimal symptoms here and there are frequent, but if you have a persistent ulcer, and the key word is persistent, so if you have an ulcer which has lasted more than 3-4 weeks at the same site, if you have an ulcer which is hard, not soft but hard, and if you have an ulcer which is painless, then be very worried. That doesn't mean that if you
अल्सर
have
वाली
a
बात बहुत ज़रूरी हुई. देखिए, ये अगर 3 हफ्ते से ज़्यादा अगर मुंह में छाला है और नहीं ठीक हो रहा है उसी जगह पे, तो वो इम्पॉर्टेंट है. अगर वो टच करके देखे, अगर वो हार्ड है, वो भी एक अच्छा साइन नहीं है. और अगर पेनलेस है, हम लोग कई बार दर्द के लिए सोचते हैं कि दर्द वाली चीज़ ख़राब होती है. इस केस में अगर दर्द नहीं होता है और हार्ड है और परसिस्ट कर रहा है, तो उसे हमें इग्नोर नहीं करना चाहिए और डॉक्टर से ज़रूर मिलना चाहिए. तो इन ट्रीटमेंट फॉर ओरल कैंसर देयर बीन लॉट ऑफ एडवांसेस, एंड ऑब्वियसली our viewers will not be able to comprehend the details of surgical advances, but broadly speaking, what has changed and how does it impact quality of life? Has that part changed? Cure rates and quality of life?
Cure rates are changing slowly. Quality of life has changed very dramatically. So when it comes to oral cancer, the prime modality remains to be surgery. And oftentimes when cancer is advanced, then it has to be supplemented with radiation and chemoradiation. There are situations when radiation alone is also effective, but in most majority situations, especially in large situations, surgery is the mainstay of treatment here. The biggest advance in the last 20 odd years has been with reconstruction, that when you remove some tissue, then you can replace it with something and give the patient back function and cosmesis. And this was a huge advance because oral cancer naturally, being mouth cancer, it's debilitating in terms of function, wherein patients have difficulty in swallowing or speaking after their treatment for their cancer because of the illness and because of the treatment. That has changed because now it is routine to use reconstruction, and often free flap reconstruct, which basically means that you take tissue from the forearm, or you take tissue from the leg and you transplant it into the mouth, and with that you can reconstruct a lot of issues, a lot of disability. But what has also changed very dramatically, and which is now beginning to possibly show some impact on cure rates, is that with improving radiology and scans and MR, we understand that cancer so much better, that resection is better, and the concept has moved on to doing wider resections, which are nevertheless not debilitating. Basically, we call this as surgeons compartmental resections, and now there are clear techniques of compartmental resections for different kinds of oral cancer, and that is beginning to show an impact in terms of cure rates.
So both things have changed. Cure rates have improved and a lot of new techniques in surgery are being used, but what has dramatically changed, as our expert tells us, is the fact that the mutilating surgery and the sort of negative self-image and the physical difficulty following surgery for oral cancer has improved a lot. And that is really possible because of numerous reconstruction techniques. Often oncosurgeons work with plastic surgeons and all together, and they create magic there sometimes. You know, sometimes people can't even figure out that they've had a surgery there. So, so there's a huge change there, and I've seen that happen as we have seen medicine change. We have seen that change happen. So there's also this thing about radiation, Dr. Lokesh, and radiation is a very important aspect of treating oral cancer. Would you like to enlighten us on the advances in radiation and the role of radiation in oral cancer?
So fundamentally, oral cancers are more of loco-regional disease. So wherever it can be removed through surgery, we would want it to be removed so that the burden of cancer that is handled by us is less. So many times when there is a very advanced disease and it is extending to certain sites beyond where the deeper regions are being infiltrated by the tumor, at that point, the surgery can become more morbid. So at that point, we would, wherever surgery has been done, generally we give post-operative radiation therapy to these patients. And where the surgical options are not possible, then we would consider these patients for radical radiation. So most of the time, within the oral cavity, there are different zones within the oral cavity. They behave differently. Some of them are more localized, some of them are local and very limited to certain regions of spread to the neck. So this is what has to be kept in mind. Sometimes some disease can have a behavior where the disease can spread to the opposite neck or also, and all those things. So what happens is when we look at radiation therapy, we have evolved a lot. In the last 25 years, there has been dramatic changes that has occurred in the technology and software that can be used for treating these patients. So literally, we treat these patients now pixel by pixel. So there used to be a time when the radiation therapy used to be quite morbid with a lot of toxicities during treatment and after treatment also. So nowadays, the toxicities are so limited. We can contain the zones of radiation, contain the doses to the normal tissue like spinal cord, eyeball, and things like that. Even the middle ear, inner ear, the doses of radiation can be contained. And when the neck is being treated, we can tailor the radiation dose, literally kind of paint the doses of radiation around these areas. And also, when mouth is being treated, we can treat only one side of the mouth where the tumor was located with a reasonable margin and spare the opposite side of the mouth oral cavity. And also, the salivary glands also have to be spared because most of the wetness in the mouth is very essential to maintain the oral hygiene. So, if the salivary glands are knocked off, there will be acidic pH and more late issues can happen. So the advanced radiation techniques are now currently available in many centers across the country, and especially the basic minimum technique these patients can be treated are three-dimensional radiation therapy. But IMRT is the next level of radiation therapy. IMRT means intensity modulated radiation therapy. So this is another advanced technique, and a lot of advancements in the IMRT techniques also are available. And the doses of radiation can be very well controlled and delivered to where it is available, where it is to be delivered. And most of the centers across the country have nowadays started installing linear accelerator with the basic minimum IMRT facility. So I think in years to come, I think IMRT will become the standard of care to most of the patients across the country.
I think we're running out of time, but those are very, very important points. And you have explained to us the advances in radiation, advances in surgery, advances in radiation, the sophistication in radiation that allows much less morbidity, much less damage to surrounding tissues, and IMRT, as you said, an increasing availability of this technology across the country augurs well for us. But the fundamental is prevention.
Oh, yes.
The fundamental is prevention. Why should we have these doctors struggle day in and day out and us suffer? ये हमको समझना चाहिए कि हम खुद ही सफ़र करेंगे और हमारे डॉक्टर भी सब जी जान से लगे रहते हैं. अगर हम पहले से थोड़ा प्रिकॉशन ले लें, टोबैको से दूर रहें, मुंह को साफ रखें, ये चीज़ें फॉलो करें, तो हम बहुत हद तक ओरल कैंसर से बच सकते हैं. टाइम हमारा ख़त्म हो रहा है, लेकिन आपसे लास्ट कमेंट चाहता हूँ. कीमोथेरेपी का भी रोल होता है इसमें कुछ? ये कैंसर माने सर्जरी, रेडिएशन, कीमोथेरेपी. कीमो का क्या रोल होता है?
कीमोथेरेपी इज द थर्ड लेग, द थर्ड लेग फॉर कैंसर, बट ओरल कैंसर में इसका रोल बहुत लिमिटेड है. ऑन इट्स ओन कीमोथेरेपी का कोई रोल नहीं है आज के दिन में. फ्यूचर ज़रूर प्रॉमिसिंग लगता है, पर आज के दिन में ऐसा कोई ओनली कीमो का रोल नहीं है. कीमो यूज़ की जाती है एज एन एडजुवेंट, कि जब आपको सर्जरी करनी है, जब सर्जरी की है, अगर बहुत अग्रेसिव डिजीज़ है तो विद रेडिएशन यू यूज़ कीमो टू इंक्रीज द इफेक्टिवनेस ऑफ रेडिएशन. And sometimes we use chemo when we have very advanced disease जो conventionally आप effectively treat नहीं कर सकते. So then we use chemo to downsize the tumor, decrease the size of the tumor, and then make it amenable to further treatments. But in general अकेले में chemo का आज के दिन में रोल नहीं है.
So जैसे बताया हमारे experts ने, the first role is of surgery. जैसे डॉक्टर लोकेश ने बोला, ये जनरली लोकलाइज या रीजनल कैंसर्स होते हैं, उतनी जल्दी से पूरे शरीर में नहीं फैलते हैं। तो लोकलाइज्ड माने सर्जरी का रोल ज़्यादा होगा। जो कैंसर सब जगह फैलेगा जल्दी, उसमें कीमो का रोल ज़्यादा होगा। तो ओरल कैंसर्स में सर्जरी का रोल ज़्यादा होता है, उसको बैकअप करते हैं रेडिएशन से, और रेयरली कभी कभी कीमोथेरेपी की भी ज़रूरत पड़ती है। पर जैसे मैं रिपीट करूँगा, एज वी कम टू द एंड, सबसे इम्पॉर्टेंट इसमें प्रिवेंशन ही है। और इतना देखिए, सब लोग कोशिश कर रहे हैं, डॉक्टर बता रहे हैं, सरकार इतने बड़े बड़े कैंपेन रन कर रही है, फिर भी जैसे बोलते हैं ना, हम लोग अपनी आदतें नहीं छोड़ते हैं। तो ये एक अच्छा तरीका है हमें फिर से सोचने का इस बारे में, अपने बारे में, अपने बच्चों के बारे में, कि इस तरह की आदतों से दूर रहें। स्मोकिंग, स्मोकलेस टोबैको, तंबाकू, ऑल दैट इज़ नॉट गुड फॉर अस। एंड सिर्फ इनको छोड़ने से हम बहुत सारे ओरल कैंसर्स से बच सकते हैं। Thank you very much for being on the show, and thank you viewers for being with us. We'll be back next week with more information.